Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
Which of the following rehabilitative measures should the nurse teach the client who has undergone chest surgery to prevent shoulder ankylosis? 1. Turn from side to side. 2. Raise and lower the head. 3. Raise the arm on the affected side over the head. 4. Flex and extend the elbow on the affected side. The correct answer is 3. A client who has undergone chest surgery should be taught to raise the arm on the affected side over the head to help prevent shoulder ankylosis. This exercise helps restore normal shoulder movement, prevents stiffening of the shoulder joint, and improves muscle tone and power. Turning from side to side, raising and lowering the head, and flexing and extending the elbow on the affected side do not exercise the shoulder joint. The nurse has assisted the physician at the bedside with insertion of a left subclavian, triple lumen catheter in a client admitted with lung cancer. Suddenly, the client becomes restless and tachypneic. The nurse should 1. Assess breath sounds. 2. Remove the catheter. 3. Insert a peripheral IV. 4. Reposition the client. The correct answer is 1. The nurse should first assess for bilateral breath sounds since a complication of central line insertion is a pneumothorax, which would cause an increase in respiratory rate and drop in oxygen, causing irritability. The nurse should also assess blood pressure and heart rate for the complication of bleeding. A chest X-ray will be performed to determine correct placement and complications. A central line was most likely placed because peripheral IV access was not available or adequate for the client. Repositioning may be considered after assessments are done. A client with rib fractures and a pneumothorax has a chest tube inserted that is connected to a water-sealed chest tube drainage system. The nurse notes that the fluid in the water-seal column is fluctuating with each breath that the client takes. What is the significance of this fluctuation? 1. An obstruction is present in the chest tube. 2. The client is developing subcutaneous emphysema. 3. The chest tube system is functioning properly. 4. There's a leak in the chest tube system. The correct answer is 3. Fluctuation of fluid in the water seal column with respirations indicates that the system is functioning properly. If an obstruction were present in the chest tube, fluid fluctuation would be absent. Subcutaneous emphysema occurs when air pockets can be palpated beneath the client's skin around the chest tube insertion site. A leak in the system is indicated when continuous bubbling occurs in the water seal column. A 15-year-old has been admitted to the hospital with a diagnosis of acute lymphocytic leukemia. Which of the following signs and symptoms require the most immediate nursing intervention? 1. Fatigue and anorexia. 2. Fever and petechiae. 3. Swollen neck lymph glands and lethargy. 4. Enlarged liver and spleen. The correct answer is 2. Fever and petechiae associated with acute lymphocytic leukemia indicate a suppression of normal white blood cells and thrombocytes by the bone marrow and put the client at risk for other infections and bleeding. The nurse should initiate infection control and safety precautions to reduce these risks. Fatigue is a common symptom of leukemia due to red blood cell suppression. Although the client should be told about the need for rest and meal planning, such teaching is not the priority intervention. Swollen glands and lethargy may be uncomfortable, but they do not require immediate intervention. An enlarged liver and spleen do require safety precautions that prevent injury to the abdomen. However, these precautions are not the priority. A 12-year-old with leukemia will be taking vincristine. The nurse should encourage the child to eat what kind of diet? 1. High residue. 2. Low residue. 3. Low fat. 4. High calorie. The correct answer is 1. Vincristine may cause constipation, so the client should be encouraged to eat a high residue diet. The other diets do not help with constipation that can occur while receiving vincristine. A multigravida client is admitted at 16 weeks gestation with a diagnosis of hyperemesis gravidarum. The nurse should explain to the client that hyperemesis gravidarum is thought to be related to high levels of which of the following hormones? 1. Progesterone. 2. estrogen. 3. Somatotropin. 4. Aldosterone. The correct answer is 2. Although the cause of hyperemesis is still unclear, it is thought to be related to high estrogen and human chorionic gonadotropin levels or to trophoblastic activity or gonadotropin production. Hyperemesis is also associated with infectious conditions such as hepatitis or encephalitis, intestinal obstruction, peptic ulcer, and hydatidiform mole. Progesterone is a relaxant used during pregnancy and would not stimulate vomiting. Somatotropin is a growth hormone used in children. Aldosterone is a male hormone. A laboring client at -2 station has a spontaneous rupture of the membranes, and a cord immediately protrudes from the vagina. The nurse should first 1. Place gentle pressure upward on the fetal head. 2. Place the cord back into the vagina to keep it moist. 3. Begin oxygen by face mask at 8 to 10 liters per minute. 4. Turn the client on her left side. The correct answer is 1. The nurse should place a hand on the fetal head and provide gentle upward pressure to relieve compression on the cord. Doing so allows oxygen to continue flowing to the fetus. The cord should never be placed back into the vagina because doing so may further compress it. Administering oxygen is an appropriate measure but will not serve a useful purpose until the pressure is relieved on the cord, enabling perfusion to the infant. Turning the client to her left side facilitates better perfusion to the mother, but until the compression on the cord is relieved, the increased oxygen will not serve its purpose. Placing the client in a Trendelenburg or knee chest position would be position changes to increase perfusion to the infant by relieving cord compression. A client diagnosed with schizophrenia is brought to the hospital from a group home where he became agitated, threw a chair at another client, and has been refusing medication for 8 weeks. The client exhibits a flat affect, is not caring for his hygiene, and has become increasingly withdrawn and asocial. The primary healthcare provider prescribes treatment with risperidone to improve the client's negative and positive symptoms of schizophrenia. When evaluating the drug's effectiveness on the client's negative symptoms, the nurse should expect improvement in which the following: 1. Apathy, affect social isolation. 2. Agitation, delusions, hallucinations. 3. Hostility, ideas of reference, tangential speech. 4. Aggression, bizarre behavior, illusions. The correct answer is 1. When determining the effectiveness of risperidone, the nurse would expect improvement in the client's negative symptoms of apathy, flat affect, and social withdrawal. Delusions, hallucinations, illusions, and ideas of reference are positive symptoms of schizophrenia. Agitation, hostility, and aggression are the result of the positive symptoms. An outpatient client who has been receiving haloperidol for 2 days develops muscular rigidity, altered consciousness, a temperature of 103 degrees Fahrenheit, and trouble breathing on day 3. The nurse interprets these findings as indicating which of the following: 1. Neuroleptic malignant syndrome. 2. Tardive dyskinesia. 3. Extrapyramidal adverse effects. 4. Drug-induced Parkinsonism. The correct answer is 1. The client is exhibiting hallmark signs and symptoms of life-threatening neuroleptic malignant syndrome induced by the haloperidol. Tardive dyskinesia usually occurs later in treatment, typically months to years later. Extrapyramidal adverse effects and drug-induced Parkinsonism, although common, are not life-threatening. When working with clients who are experiencing chronic mental illnesses, which of the following should the nurse expect to be generally the least necessary for this client population? 1. Community-based treatment programs. 2. Psychosocial rehabilitation. 3. Employment opportunities. 4. Custodial care in long-term hospitals. The correct answer is 4. During necessary periods of hospitalization, active treatment, rather than custodial care, is needed. Among the more common needs of the chronically mentally ill are community-based treatment programs, psychosocial rehabilitation programs, and employment opportunities.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.